Hello, I'm Don Jones. I'm the chair of the Cardiff Ocean Group. I've been working in the field of digital health for over 20 years. And I'm here today to talk to you a little bit about what the current state of digital health is in the US and in the world. We might start with saying, what is digital health? And digital health is applying digital technologies to perform and deliver healthcare in the form of diagnoses, in the form of treatment and therapies, in the form of decision making, and a wild array of other applications of digital technologies that make and facilitate the delivery of healthcare and do it in a way that often is less expensive than the traditional ways of delivering healthcare. And the opportunities that exist in digital health are as broad as healthcare is in and of itself. You can imagine any number of ways where you might apply digital technologies in order to make things better, faster, or cheaper. And that brings us to the work in the application of fabrics, weaving, knitting, and materials in creating wearables of a different kind. So embedded technologies into clothing is really the opportunity we're here to talk about today. Even thinking about digital and healthcare. And what's the healthcare environment even look like in places like the United States? Well, one of the interesting facts is that 50% of all Americans have no primary care physician. And of the other 50%, only half can name a physician they go to. So literally, it's safe to say that only 25% of Americans have a relationship with a physician and therefore with part of the healthcare system. And 75% will eventually have a relationship with healthcare, but don't at this time. Healthcare is one of those interesting business arenas where everybody ultimately becomes a consumer in healthcare, but not all at the same time in their life. And so as a result, we have a marketplace where the total addressable market is 100% of the population, eventually, over time. We've got remote therapy management. This is where you're actually looking at how much of a drug is being given, how is the patient reacting to that drug, how do you titrate that drug to the right amount for that patient based on the patient's reaction, and then how do you manage that patient and that therapy over time. This is another reimbursable category, and again is driving more ways to adopt capturing data from the patient so you can create the feedback loops necessary to appropriately and clinically manage that patient. Just these three concepts are driving lots of different kinds of technologies, which include wearable clothing, wearable smart patches, which are peel and stick devices, so the data is being captured no matter where the patient is as they go about their day. This is an opportunity to jump into these equations and say, how can we deliver through the products that we are such experts at, the capabilities of remote patient monitoring? How can we enable the chronic care management of the large populations in the world? How can we get involved in remote therapy management, collecting the appropriate data so we can appropriately manage the patients? The trend in digital health drives the connectivity necessary to share information, whether it's how you attract new customers, whether it's how you share their medical records between providers in your service offering, whether it's how you collect physiological data about your patients, and whether it's how you communicate with them over their course of care, and many, many other ways. It's going to be a huge opportunity to weave digital technologies into wearables in the form of clothing and in the form of other things like straps and bands and splints, etc. And it's a huge opportunity to actually contribute far more data into the patients' lives, into the healthcare delivery system, and to ultimately help build a better product in the long run. The real opportunity is the opportunity to gather and interact with the patient for the 99.5% of the time they're not at the doctor's office or not in a hospital, which is really how they're going about living their lives, and now integrating healthcare data capture and healthcare feedback to the patient. So they're really becoming a 24/7 kind of healthcare system that's actually capturing and interacting with the patient every time it's necessary. And that's really where we're going with digital health and why it's so important to you.